Hello and welcome back. In this video, we're going to be discussing addiction pharmacotherapy. Now, it's really important for us to understand that we as counselors cannot prescribe medications, but it's really important for us to understand the impacts, what it treats, and how it can benefit our clients, right? So it's really important for us to, because we're going to serve as advocates, we're going to serve as observers, and we're going to serve as individuals who help our clients actually go through the process of gaining access to these resources. So the rationale for pharmacotherapy, right? So pharmacotherapy is increasingly utilized in addiction treatment because again, some of the symptoms that are treated by pharmacotherapy or whatnot are can help our clients recovery, um, strengthening, can help clients access treatments that can block the impacts of certain substances or whatnot to reduce use, right? Now, there's a lot of controversy when it comes to some of these drugs that are utilized in pharmacotherapy, such as um, naloxone, methadone, Suboxone, or whatnot. Those drugs can be highly debated as people can believe that they can cause the individual to leave one addiction for another, right? And the withdrawal symptoms from those drugs, even though they're treatment and they're utilized for treatment, can be as worse as the withdrawal symptoms for the client's drug of choice, right? So again, there's an ethical mandate for us to understand and offer evidence-based practices, and we need to educate ourselves on those practices so again we can support our clients. So let's talk about some of the key terms we talk about pharmacotherapy. Addiction, which is a chronic disease for compulsive substance abuse. An agonist, which is really important for us to understand because we're talking about receptors and the neural network and discussing how they drugs activate the neural network. An agonist is a drug that activates the receptors. So again, when we talk about that neural network, our neurons are communicating from neuron to neuron, and they go from in between that synaptic gap between those neurons and whatnot. And an agonist is a drug that activates those receptors to produce a biological response. An antagonist is a drug that blocks or dampens the biological response. A neurotransmitter is a chemical that transmits signals across the synapse, and there's a multitude of different neurotransmitters. There are some that are more in reference with substance abuse, like dopamine and serotonin. Um, Receptors, these are protein molecules that receive and respond to the neurotransmitters. And we have reuptake. This is the process which why neurotransmitters are reabsorbed by the neuron. So the neurology of the synapse. Again, like I said, neuron to neuron, there's a synapse right there in the middle end, and that synaptic gap is where those neurotransmitters transmits from neuron to neuron. So the presynaptic membrane releases neurotransmitters into the synaptic cleft. The synaptic cleft is the gap between neurons where neurotransmitters are released. The postsynaptic membrane contains receptors that bind neurotransmitters. I just talked about some of the drugs, some of the neurotransmitters that are more impacted with substance abuse. Here are a couple here. Dopamine. Again, we're talking about the release of pleasure and reward. You can get pleasure and reward from eating a piece of cake or eating anything that you like to eat or whatnot. So that can create those can create neurotransmitters, but also drugs create neurotransmitters, right? Some drugs create neurotransmitter at a higher rate than others or whatnot. So it creates more neurotransmitters going from synapse to this synapse. Serotonin. This regulates mood, appetite, and sleep. GABA. This is an inhibitor neurotransmitter, and its modulation can influence substance use behavior. Let's talk about pharmacokinetics and pharmacodynamics. Pharmacokinetics is how the body absorbs and distributes and metabolizes the drug throughout the body. So again, this is the way when the drug enters our body or whatnot, how it's actually absorbed into our body. The pharmacodynamics is how the drug affects the body, right? So these is how it impacts the body after it is absorbed through the pharmacokinetics. Let's talk about the biological theory of craving. So craving is a strong desire to use a substance. right? So cravings play a huge role in our treatment, and it plays a huge role in our level of care recommendations in substance abuse. Someone that is having a high level of cravings or whatnot is going to have a higher relapse potential, right? So again, depending on the drug, it can have that it can have your body can develop physical dependence on certain drugs or whatnot, which can increase the level of craving, which can increase the level of relapse potential, which can also increase the level of services that the client needs to actually maintain their sobriety. So let's talk about neurobiological basis. So cravings are linked to change in brain chemistry due to some structure due to some certain substance abuses. So our role as counselors in pharmacotherapy, we need to inform our clients about medication. We need to collaborate with the medical providers or prescribers that actually prescribe those medications. We need to monitor the impacts of the prescribed drugs on our clients. And we need to support and advocate for our clients to utilize those services when appropriate, when needed, right? So again, we can't prescribe it, but it's our job to monitor it, advocate for it, and collaborate with those providers and provide the psychoeducation to clients on its best use and how it can impact them and support them. So when we talk about alcohol use disorder, right? So alcohol use disorders, we do utilize certain drugs to help treat alcohol use disorder, to minimize the impacts of it, to reduce cravings, to help them help clients maintain abstinence or whatnot. So we use benzo benzos to manage withdrawal symptoms with alcohol, right? Now, Naltrexone is also something else we use to reduce cravings and the pleasurable effects of alcohol. And camp prostate helps maintain abstinence by stabilizing chemical signaling of the brain. Di- Dicyl, I'm trying to pronounce this correct way. Disulfiram produces unpleasant effects when alcohol is consumed. And there's other alternative therapies that can be utilized that are non-traditional treatment measures or whatnot for alcohol use disorders to go along with pharmacotherapy. Opiate use, right? Again, there are certain drugs that we utilize to reduce the cravings or reduce the impacts of opiate use or whatnot. Methadone is a long-acting acting opiate agonist that reduces withdrawal symptoms. Remember, agonist is going to actually impact or fire, and antagonist is going to block the use of the receptors. Phenephrine is a partial agonist that can decrease cravings and withdrawals. Naltrexone is an opiate antagonist that blocks the effects of opiates. And there are alternative therapies as well for opiate use, just like there are for alcohol use with some pharmacotherapy, with some of that consider more of a holistic approach and adjunctive treatments. So diversity, again, in treatment, we always have to consider diversity and culture and how it impacts a client's use of a certain substance or drug. So we need to recognize and respect cultural beliefs about medication, access to care. We need to address disparities in access to pharmacotherapy and making sure our clients have access to those drugs. I mean, we need to be educated and have resources to link our clients to those resources. And personalized treatment. We need to tailor our pharmacotherapy plans to individual client needs and backgrounds. So again, when we create our own treatment plans and our service plans for clients, we need to make sure that we are tailoring them to the client to meet their background, their needs for culture and the diversity in their belief systems. So just to close it out, we need to integrate pharmacotherapy should be a part of our comprehensive treatment plan because again, we work with that multidisciplinary team and we want to make sure we're meeting the whole needs of the client. And with certain substances, the best practices are to utilize certain withdrawal management tools, drugs, or certain drugs that help to increase the level of recovery of our clients. We want to be active in education as counselors, monitoring our clients' progress and use of their prescribed medications, and we want to support the clients to enhance their treatment outcomes, right? And we always have to again continue to learn, continue to keep up with the new research and the new um, the new effective treatments that come out. We need to be aware of those things so we can best help our clients, support our clients throughout their recovery process.